Hi, this is Dr. Gorzinski. On behalf of the entire orthopedic team, I want to thank you for trusting us with your orthopedic care and choosing us for your upcoming joint replacement. The purpose of this video is to reduce anxiety, to make the process as clear as possible, and help you to optimize your outcome. We have done our best to refine the process to help ensure you have a safe, predictable surgical outcome. We have worked with anesthesia to minimize unpleasantness associated with surgery and anesthesia. Most of our patients are able to go home within 24 hours of their operation, and we all will help facilitate you quickly returning to your desired activity levels. In the weeks leading up to surgery, it's particularly important to focus on nutrition. We would emphasize whole foods and ensure you're getting adequate protein. Please stay well hydrated. And although in general we recommend striving for an ideal body weight, in the weeks leading up to and the few weeks following surgery, this is not a good time to try to lose weight. If anything, gaining a few pounds means you're in caloric surplus, and that's best for the healing process. We will recommend some supplementation prior to surgery. This would include a multivitamin, some iron, folic acid, and vitamin C. These are all over-the-counter supplements, but prescriptions can be provided if necessary. It's very important to keep your skin in good condition prior to surgery. Any open wounds will potentially increase the risk of an infection. It is for this reason that we will inspect your skin carefully at the preoperative visit to make sure you're not at elevated risk. In the weeks leading up to surgery, we would ask that you are extra careful to avoid any scratches, scrapes, or abrasions. If you have a pimple or other skin lesion, please bring this to our attention prior to surgery. We ask that you do not shave your legs for a week or so prior to surgery, again, to avoid any nicks that could occur. At the preoperative visit, we would ask that you avoid any lotions or oils on the surgical site, as we will mark this with a skin marker, and oils make the surgical skin marker not adhere as well. In the weeks leading up to surgery, you can prepare your home to help make your recovery safer. Avoiding throw rugs is important, as this would potentially put you at risk to trip. You should obtain a walker and a cane. We can provide prescriptions if needed. If you can arrange your living situation to minimize the number of trips up and down stairs, that would be best. You will be instructed in how to ascend and descend stairs safely in the hospital, but it's best to avoid having to do this repetitively when you're at home. Preparing some meals in advance and having some additional food on hand will avoid you having to make multiple trips in the early postoperative period to the supermarket. If you could gather important items that you may need and keep them within easy reach to avoid step stools or having to kneel or squat, this would also be optimal. Many patients are on medications that need adjustment or to be discontinued prior to surgery. Obviously, blood thinners will need to be stopped prior to surgery so that your blood can clot properly during the operation, and these will be resumed postoperatively. The timing of this depends on the medication, and that needs to be discussed with your prescribing physician. ACE inhibitors are a class of medications for blood pressure that need to be stopped before surgery. Anti-inflammatory medications, including Advil, Aleve, and aspirin, should all be stopped a week prior to surgery. Diabetic medications, including oral hypoglycemic medications and insulin, may need to be adjusted or discontinued. This should be discussed with your physician. The class of medication known as GLP-1 agonist, these include Wegovy, and Ozempic all need to be discontinued a week prior to surgery. Here are a list of supplements that we recommend stopping at least a week before elective surgery. If you have known sleep apnea and you use a CPAP machine, please bring this with you to the hospital. We will place this machine on you in the recovery room, and you should use this each evening. Physical therapy as an outpatient should be scheduled prior to your operation, as there's sometimes a backlog. We would recommend that physical therapy begin immediately after your discharge from the hospital. There is no need to wait. If you anticipate being homebound for a couple weeks following surgery, home physical therapy can be arranged by the hospital discharge planners if you qualify. Some patients, although it's rare these days, will require inpatient rehabilitation at a skilled nursing facility. If this is something that you anticipate you'll need, please let us know as soon as possible so that we can begin making arrangements. Durable medical equipment, including raised toilet seat if necessary, and walkers and canes, all should be arranged prior to surgery. Our office will help facilitate this, but if you have any questions, please contact the surgical coordinator. When you are planning arrival to the hospital, it's important to bring along some comfortable clothing, which is easy to take on and off, supportive shoe wear along with any glasses or contacts that you use. If you'd prefer to use your own toiletries, please bring them. If you have a list of telephone numbers for contacts that you'd like to speak with in the hospital, please bring them along. If you'd like to bring your medications along, you're welcome to do that, particularly if you're on unusual medications. It's good to have them so that the nursing staff can confirm precisely what you are on and the dosing frequency. If you have a healthcare proxy, living will, or power of attorney, please bring these documents with you for surgery. You do not need to bring your own walker to the hospital. This should be available to you when you are being discharged from the hospital, so you can easily transfer in and out of your vehicle, but there will be a walker available to use in the hospital. Please don't bring any valuables, jewelry, or credit cards to the hospital. On the day of surgery, we would recommend nothing to eat or drink after midnight. If you are on a GLP-1 agonist, the recommendation is not to eat or drink after dinner the night before. With the exceptions noted previously, you can take your normal medications with a sip of water the morning of surgery. It's important that this is pure water, not coffee with cream or milk, as that would potentially delay your surgery. It is okay to brush your teeth in the morning. Please bring along a medication list with all of your medications listed, along with dosing frequency, so that the nursing staff can verify this with our postoperative orders. When you arrive to the hospital, please come to the main entrance. You'll be directed toward registration, which generally is on the 3rd floor. When you arrive, just let them know you're there for surgery, and they'll direct you toward the ambulatory surgery floor. The nurses will get you prepped. They will verify your medications. They will have you change into a gown. They will insert an IV. They'll begin prepping the surgical site, as well as prepping your nostrils with an iodine solution to help reduce the chance of infection. At this point, anesthesia will interview you and begin preparations for their procedure. The surgical waiting room is available for friends or family members that would like to stay. If you would prefer us to call somebody after surgery, you're welcome to leave the phone number with the nursing staff. There are a variety of anesthetic techniques that we use, including general or spinal anesthesia. General anesthesia is where you go to sleep and the anesthesia machine is ventilating for you. Spinal anesthesia is a procedure where Novocaine is injected near your spinal cord, at which point any sensation below that site will cease. You can have sedation on top of spinal anesthesia, but you'll always be breathing on your own. Regional anesthesia or nerve blocks are often used, particularly with shoulder and knee replacement surgery. The benefit there is that the anesthesia does not need to be quite as deep, and it will provide postoperative pain relief. Again, sedation is used on top of regional or spinal anesthesia to help ensure you're relaxed and comfortable. With all of these techniques, we will use medications to help minimize nausea. We do a variety of things to help minimize surgical risks. We've already talked about keeping your skin in good condition to help minimize chances of infection. Around the time of surgery, we will use IV antibiotics before and after surgery. We will prep your skin with antiseptic solutions to kill germs. We have a draping system that allows us to proceed surgically without ever having to touch your skin, which is where bacteria live. Throughout the operation, we use antibiotic irrigation. If cement is used during the surgery, we'll often put antibiotics in the cement. At the conclusion of surgery, we'll rinse the joint with an antiseptic solution, and we also leave a dose of antibiotics behind within the joint to provide a very high tissue level of antibiotic in the early postoperative period. Many of our operations are done using a robot or computerized system that allows us to be extremely accurate and to customize the procedure for you. Minimizing the chance of a deep venous thrombosis or DVT is very important. We will use mechanical compression devices on your legs during and after surgery. These are known as VenaFlow devices, and although they are sometimes uncomfortable, they are very important to facilitate blood flow in your legs. Most patients will be on a medication to thin their blood. Our preferred blood thinning medication is baby aspirin twice a day for 6 weeks. Some patients who are at higher risk may require a different blood thinning medication, including Xarelto, Eliquis, Lovenox, or Coumadin. One of the most important things you can do to minimize the chance of a blood clot is to be out of bed as much as possible. Moving your limbs, walking, weight-bearing, and moving your joints all help facilitate blood flow. Use of the incentive spirometer, which is a device you inhale against, will help reduce what's called atelectasis after surgery. This is collapse of small blood chambers in your lungs that can result in fevers. Once again, being up and about out of bed also helps minimize the chance of pneumonia. Pain control is accomplished in a variety of ways. Preemptive anesthesia means that we are providing some medications or other treatments prior to any painful stimulus. You will receive some medications before surgery. Regional anesthesia works similarly. During the operation, we'll often place a long-acting local anesthetic within the wound. And then after surgery, use of ice, compression, as well as opiate and non-opiate medications will be used. These medications will work at all levels of the pain pathway, including at your brain, at the nerves, either centrally in your spinal canal or regionally at the peripheral nerves or locally at the actual surgical site. We try to make contact with each of these aspects of the pain pathway to ensure the most complete pain control that we can. In the hospital, physical therapists and occupational therapists will meet with you every day. They will help you to get in and out of bed. They will ensure that you will safely be able to walk at least 150 feet. If you need to ascend and descend stairs, they will show you how to do this safely. They will help facilitate your resumption of activities of daily living, including hygiene, dressing, etc. With regard to the discharge plan, you should have a walker available in the vehicle that's going to be taking you home. You will have medications prescribed before surgery that you're able to pick up prior to the operation if you'd like. You should be familiar with the precautions needed after your particular surgery, and a follow-up date with us in the office should have been arranged for you. There will be a discharge summary created, and the social workers will help facilitate any services you may need. Once again, discharge to a skilled nursing facility is becoming increasingly unusual, but if this is necessary, the discharge planners will help you with this. When you go home, you'll notice there's a dressing on your surgical site. Generally, there's nothing that needs to be done with this for 1 week after surgery. It is okay to shower, but it should not be immersed in a bath. If you feel comfortable doing so, we'd like you to remove the dressing at 1 week from surgery, at which point, if the wound is dry, it can be left open. If you'd prefer to keep this covered, it only needs a dry dressing on top. It does not need any oils, creams, or other solutions applied to it. And we would not recommend putting on any additional oils, creams, or scar treatments until cleared by your surgeon. Some patients will have a special suction dressing on their surgical site known as a Prevena dressing. This should be left on for 1 week. There is a portable suction device attached to this, and that does need to be charged daily. If there is any question or concern about this, our staff can provide further instructions. With regard to showering, it is okay to shower immediately, but not immerse the surgical site in a bathtub. Soap and water should be fine, and the normal dressing we use is fairly water resistant. If it does become soaked, it should be changed. And if there are other instructions or a different dressing system used, different instructions will apply. It's important you understand the healing process, and it does evolve over time. There is an inflammatory cascade that begins at the time of surgery. The surgical trauma will create inflammation, and this will ramp up for the first 10 to 14 days. It's for this reason that many patients actually feel a little bit worse the second week than they did immediately after surgery. This is very common and most of the time is normal. This inflammatory cascade will gradually diminish and should be fairly resolved by 3 months from surgery. During this time, though, it is normal to have some swelling, some warmth, some feeling of tightness around the site of surgery. Even after this inflammatory cascade has resolved, there will be continued improvement and scar remodeling for a year or even up to 5 years in some studies. During this time, you should experience reduced pain, reduced swelling, improved range of motion, and you should feel improve strength, coordination, and endurance. Ice or cryotherapy can be very helpful around the time of surgery. Cold treatment reduces inflammation, resulting in less pain, less swelling, and usually easier resumption of activities. If you're using regular ice or ice packs, you should use them 20 minutes on and then 20 minutes off. This could be repeated continuously. If you would like to use an ice machine, this would allow you to have cryotherapy essentially around the clock. We can offer you an ice machine through our office, or you could buy one online. When you're at home, we would encourage multiple short walks throughout the day. You do not need to go for long walks. Even when you're sitting, relaxing, you should be using your muscles. That would include moving your arms, moving your legs, wiggling your toes and ankles. If you had a total hip replacement, do your very best to maintain hip precautions as instructed by your therapists. It's crucial with knee and shoulder replacements that stretching is done consistently from the very beginning. Many patients have fears about stretching or feel that if they have pain, they should not stretch. This is not accurate. It's important, and in fact, it's crucial to stretch through this discomfort for the most optimal results. We have recorded a variety of videos helping you to understand how best to stretch. We do need to hear from you if you have a fever, if you have drainage significant enough to soak the dressing, if you develop shortness of breath, chest pain, or excessive swelling of an extremity. Please give us a call for further guidance. We will now direct your attention toward joint-specific videos. Please select the appropriate video for detailed recommendations specific to your operation. Thank you for your attention.